Dr. Cheryl Pegus, welcome. We're so excited you're here. We have a broad email list and sort of engaged community that's come to events and done different things with us. And we sent them a poll to vote on their healthcare Mount Rushmore, sort of who would it be? And I think we gave them some names, we gave them some wild card options, and you came out unanimously on top. Your face is front and center in the healthcare Mount Rushmore. So we're so excited to chat with you and gain some valuable insights from your career and expertise and wonderful personality. Thanks for being here.
Thank you. That's an incredible honor, knowing the group that I'm obviously with. And I would say that it's just a reminder that to get to Mount Rushmore, I probably climbed and stood on many shoulders. So that's also that recognition. So really appreciate it.
So you said something to me once in describing a role. We sort of overlapped briefly career-wise at different organizations. We were talking about a role that you had, and you said that it was too small of a role, not in an insignificant way. It just like, this wasn't large enough, or it wouldn't be attractive enough for me to run this division, this unit, this entire organization. And that mindset mentality, I think when you were describing that position for many of us, most of us, all of us, is a career defining pinnacle. And you described it as that's not attractive enough so that ambition, that mentality, is that New York state of mind? Are you born with it? Is that something you're cultivated? How can we inspire and develop this kind of mentality in others who aspire to make major changes in healthcare?
And so I think the real question that I always ask myself is, with the amount of time and energy that I put behind everything that I do, will I leave it so significantly better that it can help transform a piece of healthcare? And I think I do go into it with that. You're aware I started as a physician. Some people are aware that the way I got into this profession was growing up with a sick grandfather, having to care for him at home because we couldn't afford healthcare, and because I think that my family felt that they were judged when they went to healthcare organizations. So today I know I took care of a diabetic foot ulcer. But what I learned from that was there is something about doing what needs to be done so that you can do good work. And when I think of that, and I think of good work that I can do, I think of, well, I'm a cardiologist. I've run practices. I've run areas at healthcare systems and at payers and at pharmaceutical companies, and I've built companies. And when I look at that and I look at what should I do next, I should do something that continues to transform. I don't feel as if, there's something too big. I feel as if it's all a bit of regular, diligent, hard work, and you could really make a huge difference. So yeah, there's a little bit of let's go big, but not let's go big for big's sake. Let's go big because you can make a significant difference and take those chances and a little bit of risk. Because if you're not a little bit fearful about how big it is, you're not helping to grow people around you and yourself feel as if you've done something transformative. And I am from Brooklyn, so.
Yeah, right. You brought it back to Grandpa. Grandpa, so we're taking away New York state of mind. We'll infuse it a little bit in all of us. I really appreciate you bringing that back to the passion and the purpose, and how can I make a broader difference? You talked about incredible career already of cardiologist and practicing. You've been stops at pharma and across the industry. You've also sort of outside of that, you've written books, you've pursued some of your own passions and things. I think there's a lot of people right now that really struggle with that kind of the discussion with your employer of, hey, I also want to write a book, or I'm doing this stuff kind of quote unquote on the side. Do you have any advice on effectively navigating either those conversations with your employers or just others that want to strike a similar balance of, I've got things I want to do, I've got books I want to write, I've got things on the side? How do you navigate that?
So some of it is planning, and recognizing what you're good at and how much time you actually have in a day. But I will start off with the most important thing to learn, and I think to project, which is saying no. Really being able to say no to many things so that you can get some things done. And so I always look at, what do I want to accomplish this year? And it could be as simple as, I will use a Pilates reformer and feel as if all of those people I look at and go, oh my gosh, how do you do that? That I would have accomplished that for the year. But I plan it kind of at the end of the year. I want to do that, or I want to write a new cookbook. And I'd like that to come out by the holidays. And then with my employer, really clear on what does success look like, even as things will happen, a pandemic happens, but what does success look like for this job? And then not being willing to be reactive throughout your days. I think a lot of people go, oh, there's that meeting coming up, I should go. Or, hey, I just got called for this conference, I should do that. It is really being able to say no to the things that weren't your intention to begin with, that weren't the things that you wanted to do to fulfill what happiness and success would look like. They're things that just get added in. And I think it's really hard, particularly when you're younger, to say, no, I can't do that, be it, to the fun evening out with your friends, or to something that, hey, we'd love you to join this work group at work. It's okay to say, I know what I have to do, but that means you have to know what you have to do. Many people don't know what their deliverables of success look like personally or professionally. And that clarity takes a little bit of upfront work, but it becomes a habit. And I really, really recommend for everyone you do it. My habits now are, I should and must spend at least 3 weeks with each of my children and do something meaningful. And it should be calendared. And we should both discuss whether it was good for both of us. Same thing with my husband, same thing with my work. At JP Morgan, I support a number of companies, but I have a lot of things that I do on my own. And so it's really, for me, am I managing my time the way I wanted to, or is my time managing me? And really not getting distracted in that occurring. And I think it's a little bit of diligence, but really it's saying no.
Hearing you give the advice of saying no means that you've said yes to us here on this call. So it makes us feel even more privileged. And so thank you. That incredible advice. And absolutely, so many of us have kind of the golden, they've described me as like golden retriever energy. And so I get energy off people and I enjoy being around it. And so I think that advice really hits home, because it is easy at every stage of a life. Like you said, you're having kids, you're getting married, you're trying to figure out your own vacation times, those type of things. It's really easy to say yes to more things than you could, and to define the deliverables. Such great advice, because
And I would
sometimes what
just add
success
to
looks like is
that,
different.
Alex, a little bit that, it's, you get a lot of LinkedIn requests, or you go to health and you've got calendars of, so many people that you frankly couldn't do it all. And I think everyone knows that. And so I think it's also, you can screen incoming, but it can't be what you do all the time. I have someone who assists me with some of that screening, but I probably do it once every 3 weeks, because I don't understand people who can handle that, all of that incoming, because it's all meaningful, it's all important. How do you slot it in? You have to kind of open your mind and your time to when you can do that, and still, work out, try a new restaurant. You've got to figure all of that out. And so you've got to say no to quite a bit. And I think people understand. If they don't understand, you know, that's something that I think you acknowledge as well. And you put that in a specific bucket.
You said try a new restaurant, but we're saying try a new recipe. And we have a friend with a cookbook that you can learn from. We'll talk about your current day job. So managing director at Morgan Health, and you've obviously held a lot of high profile roles and publicly recognizable organizations. And so Morgan Health, working to improve healthcare quality, affordability, and equity, focused, from what I understand, mostly on the employer side. And so you're writing checks, you're partnering, you're doing a lot of things. If you're in the quote unquote traditional healthcare system, so you're at a hospital leadership role, or you're in a health plan, or you're at a pharma company, is there room to work with Morgan Health? Are you being approached by them? Is there any advice you have for how do we either partner with you? How do we help make a difference?
So first answer is yes, after all the no's I just said, that yes, you should approach us. And yes, any of those organizations we actually work with today in some of the investments that we've made. But what I will tell you is, we talked a little bit about having different roles. What you learn from those roles is what's possible. And what you also learn is how much it takes to keep just running the current engine versus transforming or innovating the engine. And I like doing both. I'm an operator, but I want to change things quickly. And so part of the reason for me this role is really important is how do you add in the things that we know are still needed in healthcare? Because we all know there's a lot to fix in healthcare. And how do you do that? You've got to come in with new innovative ideas, new innovative products, services, companies. And so that's the wonder and the joy of being at Morgan Health and being able to do that. And then being very clear of what's your why. Yes, you have to be profitable in doing it, but you can go in and address areas that are not today addressed as much. So many people today, as they invest, they look at Medicare Advantage populations, managed Medicaid populations, because there are fee payments from the government for that. Employers, where you look at where value-based care could go, they're not viewed as much as being, an area that you can make the most profit, if you will. I find that really exciting. It means that it's a group that's not getting as much innovation. And there's a lot of innovation to do there if you believe after the government, employers pay the most into the healthcare ecosystem. It's also the place when you look at people who are still raising young children, you look at maternal health and what the rates are in this country, you look at the diversity of our workforce and the communities where our workforce live. There's a lot to do and a lot to innovate in women's health, health equity, how you utilize tech, healthcare professionals in the way we grow them, right? They're also part of that 18 to 64 population. So that for me is my why of doing this with Morgan Health. It's to innovate in a space that has a lot of opportunity, not yet crowded, and everything we do is pretty meaningful. I'd say the second thing that I look at when I look at this is who are the partners? You can't succeed in healthcare on your own. And I think a lot of point solution companies or a lot of people who say we'll go from tech to healthcare have realized you actually need to be in healthcare because it's an ecosystem, not so much that it's a club and it's so difficult. It's that if you don't have payment and you don't have healthcare professionals and you don't have a team-based care and you're not doing it in home and in the office, success is limited. And so we at Morgan Health partner with all of those groups, employers, payers, and we have offerings, a pre-health that you may be aware of, which is an outpatient primary care clinic, but one of the first that's doing value-based care in the employer market, because we should penetrate the employer market, but we partner with payers in doing that. And we partner with the health systems in different states. So, I get to do a lot of that. I not only work at Morgan Health, I've got time for things that I do on my own. And one of the things that I'm really passionate about is how we have healthcare professionals continue to love this field. And so a couple of years ago, built an organization called Atria Academy, where we're helping healthcare professionals get the top science from the top scientists, so on the front line that they have it right away. And we're also enabling them to have the best kind of second opinion healthcare professionals in their ears if they have any questions, and then having them take care of their own health to want to stay in this field because it's a big deal. So that's how I'm balancing my time with everything I'm doing.
Incredible. That was going to be one of the questions of, I think you're on the Mount Rushmore of cardiologists as well, right? So there's a few Mount Rushmores. That transition from bedside to boardroom or practicing physician to leadership positions. You talked about the tech wanting to be in healthcare. There's a lot of physicians right now that we see within our network that are looking into, because of that major shift in the technology aspects, are looking into board roles or full-time seats at technology companies, or transitioning into leadership within their current aspects of the healthcare ecosystem. Can you talk just a little bit about your navigation of that? And was it an aha moment, or was it a long time coming? And then maybe just some advice for some of the clinicians, nurses, physicians within our network that may be thinking along those same lines.
So I definitely knew that I wanted to do something different than just see patient to patient. I actually got my master's in public health before doing my cardiology fellowship. I did it in between internship and cardiology, just kind of stuck a year in and ran through the MPH program. And part of my reason for doing that was to broaden my skills, frankly. I trained as a clinician. Clinicians are very focused on, let's make sure we don't screw up in the quality of care that we're giving this patient, and let's make sure the next patient gets the same level of quality of care. And the issues in healthcare, just telling my story of how my family grew up, are bigger than that. I should be asking people about their food, and I should be asking people what type of transportation you use to come here. Did you have to take a day off from work? And I should be understanding from people if they have access to the internet or local pharmacies. So my interest has always been that if you took care of those pieces of healthcare, by the way, if you took care of those pieces, I know people like to use the word social determinants, but they're actually the fundamental basics of healthcare, you would decrease healthcare costs by 30%. So just thinking of it really of why do we do what we do? And you don't need doctors to do that. So I knew that before I did my cardiology fellowship. And when I went into my cardiology fellowship, I went into it with the lens that we should change cardiology. It is the number one cause of death. It has the highest health disparities in the world. And it also has the least number of healthcare professionals who look like the people they're taking care of. So, it's pretty easy. I went to Cornell for medical school and had just an incredible support system. I think you know this, but, the first African-American woman to become a cardiologist at New York Hospital, Cornell. And that in itself, is a separate story in what that takes. And so my path was only almost predetermined. When you're the first, there's a lot that you have to do to get there, but I think there's a lot that you expect of yourself. Forget what anybody else expects. And going through my cardiology fellowship, you would always hear of the principal investigators and the clinical trials. And a lot of what we do in healthcare comes from clinical trials. But if a clinical trial did not include enough women, or it did not include enough people of color, you actually have no data on how that new treatment or diagnostic works. And so for me, a natural progression was, I'm going to go to a pharmaceutical company and figure that out. I mean, really just kind of, if you want to change and you want to lead, you are going to take some risk and do things that you know nothing about. And my first corporate job was at Pfizer. And it to today remains my most humbling job. I walked in and there were junior MBAs, who knew more about overall healthcare cost, the GDP, the breakdown by demographics, the use of technology, understood payers and self-pay and formulary. Just a huge learning for me. And Pfizer gave me the opportunity to learn, and it's the place that I had my first career coach, my first 360, the first place where someone said to me, actually, my first review, which I still have framed, said, for a doctor, she has a good sense of business, which I think was an insult or maybe a compliment. I was never sure what it was. And I've gone back and asked the person who wrote it, who, if I said their name, you would know. But it was just kind of like, I'm like, okay. But they were willing to invest in me gaining additional skills. And, I got to do sub-analysis of women on calcium channel blockers, which had never been done before. We co-funded an NHLBI study called All Hat on hypertension, which was the first and largest study by the NIH on hypertension in African Americans. I mean, just think of the things that type of data allows. It's what goes into submissions to the FDA. It's what goes into formularies. It's what goes into payer models. And once your eyes have been opened to that, I mean, I just had a voracious appetite for, I know how we're going to keep knocking down pins and solving different pieces of healthcare. Managed care was there, and I was like, I know nothing about health insurance and managed care. Got a job at Aetna. And so there's a bit here, I think, as a physician, in knowing what you know. It is a small part of the healthcare ecosystem, important for the patient. But if you want to lead and change the healthcare ecosystem, you have to learn, I think, those different areas. And you have to have a lot of humility, I think, because healthcare is not so much complicated, but it requires multiple people running at fast speed, showing up with their A game. And you've got to be able to run with them and be able to communicate, complement, and come up with good strategies and then good processes for deliverables. And that, I would say, people ask me all the time, how'd you get this career? It's that simple.
Your willingness and New York state of mind to take risks and be the first and expand your own learnings and opportunities has been an inspiration for so many and a blessing to so many. I think we've heard stories, and we joked about this a few weeks ago. We have just so many people that we've run into in life that love you and appreciate you. And so thank you for what you've done and the way you've done it and the way you lead, because it really has inspired others to say, hey, she took a risk, so I'm willing to take a risk. That first person to do something, often there's that story of the mile run, that it took however many years for the first person to run a mile run under 4 minutes. And then right after it happened, it was like the floodgates opened and people started running mile runs in under 4 minutes. And so you being the first has opened a ton of doors to so many, and we're all, as an industry, so appreciative of it.
No, thank you. And I think, you asked about doing this call. One of the things that I think about a lot, I sometimes get concerned about, is if you've opened a door, please make sure you're not the only one that went through. And so, gosh, wouldn't it have been great for me if I had tons of mentors? I want to make sure that we do that. There is a lot of work to do in healthcare, a lot of work. We're seeing mortality rates increase again post-COVID. We're seeing maternal health rates be where they are. We're seeing wonderful science like in GLP-1s. We've got to figure out how do we get that to people, because it will transform what we do. And there are a lot of good people in healthcare. Some of the best parties I've had have been with people in healthcare. So I'm just saying, it's not just good work, it's good people. And, you've got to get up every day and do something. I tell everyone, particularly women, particularly people of color, young people, if you're going to think of something to do the next 20 years, let it be healthcare. even with AI, there is a lot to do in healthcare. So it's not just an industry. You are personally going to need it. And I won't ask you to hold up your hand and show how personally you'll need healthcare, but everybody needs a little healthcare.
Everyone needs a little healthcare. Well, they're already bestsellers, but we're going to make sure you sell a few more books today too.
Thank you for that. I actually use that for a lot of my not-for-profit work. We mentioned, just my journey and being from New York. I went to undergrad in Boston and quickly ran back to New York to do medical school. But medical school is expensive. I was raised by a single mom and spent a lot of time applying for grants or meeting donors. And one of the things I wanted to be able to do is take away some of the things that I knew added to, you've heard me talk about time and how you manage that, added to my time. And so back in 2000, I started a scholarship at Cornell, to pay, and every year pay for a student and make sure that people get that opportunity to maybe do some of the wonderful volunteer work that Advancement League does and not have to think about it, or food as medicine. Make sure you're supporting not just food kitchens. And so the cookbooks have a lot of meaning in kind of what we do with them and how we utilize them. It's also a way I get my kids to want to do lots of things with me, because I've one who believes he's a sous chef and the other who believes that the official title is taster. And so that's a lot of fun in the family. And my husband's the official photographer for all of the images in the cookbook. So it gets me back to, again, how do I plan my year and what are the things that I'm making sure we try to do with and for each other?
Pegus family cooking competitions. I think there's probably a few of us who need to get in on that, or who will
By
vie for
the
tickets to
way,
be as
my
the.
my cooking parties are, they're well known.
All right, 2024 goals. I got new resolutions. Dr. Cheryl Pegus, this was a blessing. Thank you so much.
Thank you. Wonderful to be with you guys.